So basically, I just want you to kind of tell everybody how you felt when you first came in. This is about, what, probably 2.5, 3 months ago?
Yeah, I think it was
when you first came in?
late middle of March.
Okay.
And I could barely walk, couldn't even sit down. I had my consultation with Dr. Joe and preferred to stand.
Right,
Couldn't
I remember
get to
that.
Sit down. So yeah, I could barely walk in here.
On a scale of 0 to 10, what were your pain levels at?
Like a 12.
About a 12 out of 10?
Yeah.
Now, did
no
you have
joke.
pain going down the leg with that as well?
I did not. It was
Okay,
purely just in the
right
back.
at the waist, right?
Yeah, purely in the back. And I had like a severe.
You were bent over to the right like
Yeah.
crazy. You had a 27 millimeter difference. Low on the right, spine was just bent over to the right hand side. That was loading those joints tremendously, creating a lot of nerve irritation, making the muscles lock up as well.
Yeah.
So how long would you say it was before you actually started to experience relief?
I would say within the first 2 weeks, I started noticing that I was feeling better. After
Right.
we were doing 3 times a week, so after 6 visits,
Yep.
I was noticeably like, oh, that didn't hurt as bad getting up. That didn't, And I would say that after 2 months, I was, as you said, a whole new man.
Exactly right. Yep.
And
I
now
said in
it's,
2 months you'll be a whole new man.
Yeah, yep. You were like, give me a little bit of time, you'll be a whole new man. And I was hesitant at first.
Sure.
And actually, I give props to my wife who said, hey, come into the chiropractor. And I was dumb, and I was like, my general doctor says that this is what you're going to live with. This is muscle pain, not bone pain.
Right.
And then I came in here, you're like, we got to fix the mechanics, and it'll all work.
Exactly.
And then here I am, all the mechanics finally working in the right direction, and
yeah, exactly.
we're good to go. So
when the joints aren't working right, that's going to interfere with the nerve. That's going to make the muscular situation. So you can never separate joint, nerve, and muscle. Very rarely is it just one.
Mm-hmm.
Usually, if you injure a muscle, it's going to affect the joint, which is going to affect the proprioceptors or the nerve. That's going to have an effect on the muscle as well. It's like a negative feedback loop. You got to get in there and basically change the structure as much as possible. Take the irritation off the nerve, get the joint moving better, calm down the muscles. Pain goes away, inflammation goes away.
yes.
So, you have any difficulties with any type of function at this point? You were talking about
no.
working on your house yesterday.
Yeah, this whole past 2 weeks I've been doing some very hard labor on my house, pulling out, being in weird compromising positions, pulling out lumber, putting in lumber, putting everything you got into getting like the screws screwed into old wood. And
Awesome.
My back the whole time has been keeping up with me, and the rest of my body's like, all right, it's time to go sleep. My back's like, come on, what else you got?
Right? Doc, zoom into this x-ray here on the left-hand side. That was his initial x-ray. And then get also a shot of the x-ray on the right, showing his after treatment x-ray, which looks 100% better. Very good. All right, let me